Hi, everyone, and welcome to episode 42 of the Pet Behavior Chat. And we're going to do a little bit of, we're going to move on from last week where we did Fear Free Practice Tips for Dogs with Ilse, and we're going to do Fear Free Practice Tips for Cats this week. And we've got Nora here. So again, we want this to be a super practical episode. We want, if you're either a veterinary professional, a veterinary nurse, or a veterinarian, or maybe a front of house team member in a veterinary clinic, or if you're a pet caregiver, we want to give you some like super easy to implement practical tips that you can go away and implement in your practice today. So it's going to be inexpensive, things that don't take a lot of time, but that make a huge difference, as we found, to our feline patients. And if you have not listened to last week's episode on dogs, and if you're interested in the same thing in dogs, please go back and have a listen to episode 41. That was last week. And also episode 37, where Ilse and Nora and myself talk about how we actually became a Fear Free certified veterinary practice. So those are all kind of episodes that talk about similar things and talk about that sort of in practice approach to improving the patient experience. So we're going to go through our top 5 tips. Well, they're actually Nora's top 5 tips. So Nora's going to go through her top 5 tips on what we think really makes a big difference, a quick win. And then we are going to leave you right at the end, each of us, with one thing that we absolutely couldn't do without anymore when it comes to feline practice. So welcome, Nora. Great to have you with us again today.
Thank you. I'm always excited to talk about cats.
Yep, I know. So let's just jump straight in, I think. So what do you think is your number one top tip of something that can make a really big difference really quickly and really improve that feline patient experience in practice?
So one of the couple of tools that I just don't think I could do my job without is puree. So the little treats for cats. We use one that's puree, but there's so many on the market. There's churros, I think, and lots of different ones. I don't know how I was a veterinary nurse before this stuff was invented. It is just absolutely amazing for cats. They love it. I know very few cats who don't respond to it. It has so many uses. I mean, it's great to give as a treat for distracting when a cat is being examined or has vaccines. But because it's liquidy kind of paste, you can actually apply it to so many surfaces. So we don't just put it on the exam table or on a licky mat, but I like to put it on vertical spaces too. And if the vet needs to see something or needs the cat to actually be somewhere else, actually using it. Ilse talks a lot about Hansel and Greteling, so a similar idea, but actually smearing it up on the wall. We have a couple spaces in our consult room, and you can just use it so easily, and it's very easily cleaned after. And there's something in these products that cats just will do anything for. So those I've found throughout the last number of years using it that most cats, I feel, tend to prefer the fish varieties. So we always get like fish and chicken. And when I'm in the consult room and I open one and it's white and I know it's chicken, I'm like, it's 50-50. But if I open one and it's that kind of peachy brown color, then I know right away that the cat's gonna love it. So using puree, having it stocked up in every consult room, it's very inexpensive, and it's something we have everywhere here, and it's as important as the stethoscope in an exam. So I cannot say enough how important it is. It's the worst feeling in the world when we're out of stock of it, because nothing can really replace that stuff.
Yeah. I think we need to put a tiny little caveat on that, in that if we do have a cat that's coming in for maybe gastrointestinal issues, or if we have a cat that's so fearful that they don't actually respond to it, although I totally agree with you, I would say 9 out of 10 cats really respond well to it, then we probably need to think about sort of other things. And we talked about this in last week's episode with dogs, but sometimes play and toys can be substitutes for that. And again, it just depends on what the cat finds really reinforcing. But for pretty much the majority of our routine visits, whether that's vaccinations or whether that's, the first kind of kitten checkup that we do, or whether we're examining skin or senior patients, right? They absolutely love that stuff. And the thing I also love about it, like you said, is the versatility of it, right? So because it's a paste, You can smear it, you can put it on your finger, you can give it straight from the little tube, and you can even coat deworming pills in it, and many cats will take it. So yeah, I love that one.
Yeah, absolutely. And I think what's great about it too, as a treat, is that if we have a cat in dental pain, which we see a lot of, they're still often going to eat that. So it's the best treat. We have a little buffet of treats, and that is definitely by far the most popular one. Toys, yeah, are amazing. Also catnip. I love using catnip in the same way. If we have somebody come in who's fasted and that, especially if we know their history with catnip, if it is something they enjoy or respond to have that on hand too.
Yeah, no. And one of the tricks that I absolutely love, which I see you guys do a lot, and which, we do a lot, is if you want to get a jugular blood draw, and you just kind of hold that puree up so the cat is naturally elongating their neck to lick at the puree. It basically just, without us having to put hands on the cat, naturally positions them in that position for us to be able to get a jugular blood draw, which is so nice, right? Because the more hands off we can be, the better.
Totally. I remember in school learning about the traditional restraints, how you restrain for jugular, how you restrain for all different placements. And I was just thinking, as you were saying that, like what they really need to have now in veterinary colleges and nursing is, instead of like a restraint part of the course, is they should actually have like puree placement, because you can get most cats into any position that you need using that, and how much more valuable that would be to the next generation of nurses.
Yeah. Couldn't agree more. Amazing. All right. So puree is number one. What's your number two top tip?
I think something I've always liked to do is to help create a home environment in the clinic. So if we're talking about inpatients, we know cats are very territorial. We know that their home environment is very important to them, and that coming to a veterinary clinic is going to be, somewhat of a stressful experience. And if the cat then has to stay with us, we want to do everything possible to help them feel at home, to help things feel familiar. Things being familiar is really important to cats, and all of these things decrease their stress and then help to hopefully heal them sooner. So we love to ask clients to please bring in their favorite blanket, or just to bring in a t-shirt that they're wearing that day. If we have long-term hospital patients and the owners are visiting, we're like, please bring in something new every day, something that smells like their owners, something that smells like their pheromones, where they've marked around the house, just something that smells like home. It's super important to them. And with the blankets that we wash in clinic, they're absolutely fine. They're very comfortable. We've taken a lot of time to choose them, but they don't smell like home. They smell like the veterinary clinic. So anything we can do to make things more familiar, and that includes food bowls, toys, or even the owner's presence. We love when owners come and visit their cats in hospital. Just really recreating a familiar environment for cats when they're with us is I think super important and free and easy to do. It's, when you talk about these changes to make a fear-free hospital, I guess sometimes you do have to invest some money, but that you absolutely don't. That's something everybody can do. And I think from a client perspective, that's really nice to hear a nurse or a vet asking, please bring something from home. It just sort of shows, as far as the bond with the client, how much we really care and how much we want them to be part of the treatment as well.
Yeah, and I think that's such an important point that you said there, is tying the caregiver into their cat's hospital experience. I think sometimes clients and caregivers can feel a little bit helpless, and they're kind of handing over their precious bundle to us, and they don't really have a lot of input into that. So I think being able to actually pack a little care package, a little hospital bag at home with all of their favorite items, I think that's so valuable for so many reasons. But obviously we know that a cat's sense of smell is so very important to them. The other thing that just came to mind as you were saying that is litter box preferences. So we know that litter box preferences can be individually really different. So just asking that simple question to a client about, does your cat prefer an open or a covered litter box? And, what do they have at home? And we've experienced this ourselves, haven't we? When we've had sort of complex surgeries and the cats maybe haven't, used the litter box after surgery. And it's been as simple as, at home, they usually have a covered litter box. So then changing that up and being able to provide them with what they're familiar with, what they're comfortable with, what their preference is. And again, that's free. I'm sure every veterinary clinic has got an array of both open and covered litter boxes, and it's just taking the time to actually think about those small details that might make all the difference to the patient's comfort, but also their clinical outcome, because the last thing that we want is for a cat not to use the litter box. So all of those things. So trying to recreate as much as possible their home environment in the clinic.
Yeah, absolutely. I know exactly who you're talking about. And one was Elsa, our little kitty who had a craniotomy just over a year ago, and she wouldn't pee. And then just this one quick 2-minute conversation with the owner, finding out she prefers covered litter trays. She went in and she used it. And I think that, for vets and for nurses, and we're kind of scientifically minded normally, we want to get the facts. We want to see the blood results. We want to know the length of the symptoms. But it's really important to take this holistic approach and actually treat them also by using things that are of comfort and that are going to make them feel at ease here. So getting all of those details, it's just, it's crucial. And again, it's free and it's easy and it's hugely valuable.
Yeah, no, amazing. And I love that aspect that, it's free, because what we don't want to do is give people tips that, are going to be massively cumbersome and, financially a burden on the practice. So free tips or free things to do are always good tips for sure.
Just on it, just one example I just wanted to share. It's actually a boarding patient of ours, and I love what she does. And this was based on our recommendations, because her cat, who's a senior cat who's asthmatic, she gets very, very stressed normally leaving her home. And every time she comes to board, her owner comes and brings everything from home, her own scratching post, her own dishes, her own water, literally everything is familiar. And she comes to us one day before the boarding, and she rubs all of Abby's pheromones all over her kennel that she's going to be staying in, and she presets everything so it is super welcoming for her arrival. And then she wears a number of t-shirts in the time before and seals them in Ziploc bags so that she always has fresh smells. That's like the ultimate version of this, and just being able to recreate that on a smaller scale is amazing.
Yeah. And again, I think it just shows how important it is to many caregivers to be involved in their cats, whether it's a hospital stay or whether it's a boarding stay. So here in the UAE, we have lots of cats that come to us for boarding whilst their caregivers travel. But I think for a lot of caregivers, that's massively important, is being able to have input and say in how their cats are cared for whilst they're with us.
Absolutely.
Right. That was number 2. What's your top tip number 3?
So I think this one actually ties in nicely with what we just talked about, but it's basically recording information and leaving each other notes. So it's about communication within the team. If you see something work, record it. And we're pretty good at doing that on our software program, which is amazing. And we kind of tell each other, like, make sure to write "this cat loves catnip," because you never know what nurse is going to see them in a year from now. And it's super important to record those preferences, because that can cut down your time and stress, hugely, to actually read the file ahead of time and see, okay, they love this, and they need to avoid this. It's like you are just handing them on a platter the perfect consult. It's amazing. I like to do it not just in the clinical notes, but actually in clinic on hospital sheets. I'm more of like a handwriting sort of person, and I find it very valuable every time I admit somebody, whether it is, for a spay or if it's a sick patient. On their hospital sheet, I have handwritten, "I heart catnip. I heart whatever it is that the owner has told me or that I have found to be true from that admit appointment." I make sure it's there. Sometimes we go to the point of we'll make a big sign. I think, kennel signs are amazing with preferences and that. We'll make a big sign to show that, so that the nurse is coming on the next shift, or the overnight nurse, or the vet who's been off for the last 2 days, before they even touch the patient, they can quickly see this visual, okay, this is what I need to use. Somebody's taken note of that. We all have so much information we're gathering every time we examine an animal, but we normally keep it in our head and we don't share it. And that's something that's kind of become a big part of our team culture here, is constantly sharing it just makes everything a little bit more enjoyable. It kind of brings us together as a team, and it's very valuable for the patients, of course, that no matter who is examining them or who is treating them, that they already know their preferences. So I think that sort of level of communication is, again, free and is going to make a big difference to any clinic.
Yeah, absolutely. And again, yes, like you say, it's free, but also if you think about the amount of time you could potentially save by having that information already there. So when you do perhaps bring the cat out to examine them, if they're in hospital and the vet's examining them at their morning rounds, rather than spending 5 minutes trying to figure out where this cat is most comfortable, you have that information at your fingertips, and it's going to save the vet's time. And we all know how important it is, for vets to be able to work in a time efficient manner. That's also going to make the boss of your practice happy, because that's going to, increase efficiency. But it's going to massively reduce stress levels also for the cat, which is going to have a positive impact on clinical outcome. So it's kind of a win-win for everyone. And like you say, it's easy. Sometimes it takes a little moment to kind of, start implementing that culture amongst the team. But it's completely free of charge. It's just a question of, observing, noticing, and writing something down, making the notes, and for everybody to be aware that that information is there for them to make use of. So I think that's really important too.
Yeah, and it only takes one person to start it. Even if you're the only person writing notes to yourself over and over, you just keep doing it, and other people will see the value of it, and it will become something that, is picked up more and more. And it's nice to be able to start something if it's not already being done, and to make that difference. Another thing on like the value of it for the business side is we're not opening 10 things for cats each time. If I ask a client on admit, what do they like? And they tell me they only like tuna, they don't like anything else, then I know that's what we need to have ready for them when they've recovered from their surgery. We're not going to open, the kitten mousse and the recovery. We're not going to open those things, which then potentially can get wasted. We're going to know exactly what they want. That is what we're going to open, and it's going to be useful.
Yeah, no, absolutely. And I think that makes everybody happy, because I think sometimes implementing something new like a fear-free approach can be a little bit, daunting. And I think perhaps many practice owners might be a little bit skeptical of that, just because they don't really understand the financial implications. It seems like there's a lot of initial outlay, maybe kind of changing things, buying pheromone plugins, buying a lot of different treats. But I think, being able to demonstrate over time just how time saving and, how much we can reduce waste, which is also great for the environment. I think all those things have such a positive impact in the long run.
Yeah, and I think this is maybe almost a potential different point, but it is something I wanted to mention, is if you're becoming fear-free or you want to implement that in your practice, it is really a baby step process. It's something that you have to layer on little bit by little bit by little bit. And that's the way people are going to digest it. That's the way the team are actually going to embrace it, is adding things in a little bit at a time. If you're somebody like a nurse who's taken this course separately from your practice and comes in and like, I want to do all these things, it's not going to stand up. It's about little things and baby steps. And that's how we did it without really knowing this is going to be the end point, is actually becoming a fear-free certified practice. But that was the way that people took it on themselves and were able to actually have daily action points that they could learn from. And I think that's really important, is one little thing at a time.
Yeah, couldn't agree more. Incremental steps towards a bigger goal, for sure. Amazing. Right. Number 4, top tip.
So I'd like to, it kind of involves a few things, but it's essentially about cats waiting, things you can do for your waiting room. So here at German Vets, we don't like any patients to have to wait in the waiting room. We schedule in a way that when they come to the clinic, they can go straight into the consultation room. That's not possible in all clinics. And even here, sometimes it's not possible if we have emergencies, walk-ins, that sort of thing. So we need to make sure where the cat is waiting is as cat friendly as possible. And these are some easy things you can implement. I mean, definitely having a separation in your waiting area, which can be done through bookshelves or through cat scratching posts on display, which is what we use. But having a visual separator in the waiting space is very important, so that cats and dogs don't have to see each other. Again, another easy visual blocker is just to put a blanket over cat carriers when they come in. Every carrier that comes in, even if they're walking straight to the consult room here, has a blanket put over them. It just acts as a visual block. There is so many things to see when they come into the clinic, and that will be potentially triggering and stressful to them. So just putting that blanket helps to keep them calm. Even better if you're able to use, pheromone spray in your clinic. We use Fellaway, and the blankets every couple hours are sprayed. So when the cat is covered, it's with a blanket that's already been pre-infused with Fellaway. So that is really, key to their visual, being able to block their visuals. And we also know about cats, they do not like being down on the ground. They feel safest up high when they're in a vulnerable situation. Also on the ground is where dogs are. So it's really easy and a quick win to put cats at a height when they come in, as long as it's a safe, secure place. Lots of clinics owners will come in and just put their cat right up on the desk, which is fine if it's big and stable, but it would be ideal to use even bookshelves. Many suppliers as well will happily give your clinic a cat carrier tree where you can put them nice and securely. It's about reaching out to those suppliers too. They love supporting initiatives like this. So having carrier trees, having IKEA bookshelves, which we also use, with a little non-slip pad where the carrier can just go on, even if it's a few inches, but just not on the ground, and ideally higher, just helps cats feel really safe. So creating your waiting room in a way doesn't mean you have to get an architect in, an interior designer, and completely change it for it to be fear-free. You can just change the layout a little bit. Look through your practice. Where do you have a table that's not being used, a coffee table, and have that as a dedicated space for cats to wait on. I think it's really important for that in-between time when stress can be building, that we just try to keep them as calm as possible.
Yeah, it's funny that you say coffee table, because that's the thing that immediately came to my mind, is, just having a really inexpensive coffee table. Again, you can get them at IKEA, and I'm sure many other places, something at a height that, is big enough and sturdy enough to accommodate a cat carrier. I think that's a really great tip. And I agree. And I also want to stress, like Nora said, you don't have to completely remodel and redesign your clinic. In our hospital ward, we use room dividers sometimes to actually just visually shield cats that are maybe having a blood draw, so that other cats can't witness that and can't see that. And it can be as simple as that. Also in your waiting area, you can have room dividers, whether that's a screen or whether that is a bookshelf, and you can have some really great kind of information material on the bookshelves, or plants, or whatever it is that you like. But I think that visual barrier is important. And the very last thing we want is for excitable Labradors to be coming over and sniffing the kiddie carrier that's on the floor, and the poor cat inside can't escape because it's in the carrier, and then may get extremely scared, stressed, and worried, and then has to go into the consult room and be examined by the vet. And you can imagine that consultation is going to look very different than a cat that hasn't kind of faced that sort of stress or out in the waiting area. So yeah, I agree. I think species separation is a big one. And, I spoke to Isabel Resch on one of our previous podcast episodes about rabbits as well. So this doesn't go just for cats, but it goes for any species that's a prey species and that might be really worried about little predators looming over them and causing them to feel worried.
Another really easy thing you can add to any reception is music. So if you can have cat-specific music, dog-specific, or just a calming classical music, if you do have both potentially waiting in the same area, it really just helps to add to, first of all, maybe blocking out some noises if there's dogs barking upstairs, but it just creates a calmer environment, both for the clients and also for the patients. And that's, again, something so easy. If you have a phone and a Bluetooth speaker, that you can do that in that waiting space as well. It makes a big difference.
Yeah, I love that. And we have Through a Cat's Ear playing most of the time in our dedicated cat areas. And and there is research on that to show that music can absolutely reduce stress in the hospital environment.
Yeah, I love that. The through a dog's ear and through a cat's ear, they're so relaxing. It's just such a calming and beautiful piece of music that I actually ended up using it to put my baby to sleep, and it worked for a year. So it is that relaxing for humans as well. So it's something that you can download and use in your practice for sure.
And at home, right? Like, as you say, you use it at home. So something that caregivers can use at home as well if they want to create a more relaxing environment for their pets.
And in the car, that's another, on the way to the clinic, that is also something that is very easily done, just to put that on in the car instead of your normal podcast or music that you're listening to. If you are transporting your cat to the clinic or to a boarding facility, to put that on as well is a nice idea.
Yeah, no, that's a great point. Amazing. Right. Final one, top tip number 5. What have you got?
So I really love this one. It takes a little bit longer to implement in most clinics, but it is so worth it. And that is not removing the cat from the consult room if you need to do a procedure like take bloods, place a catheter, do a cystocentesis, those sorts of things, is not to remove them from the room, not to remove them from the caretakers and do the traditional taking them upstairs or taking them in the back, and just to actually keep them with their owners. If the owners want to be there, they can be a really positive influence, but to keep them in the same place where they are. If you're in a consult room and the cat is pretty okay with being there and has seen, okay, there's nice people and there's treats and there's catnip and I'm allowed to walk around and I have a high D space and I'm feeling okay about being here, don't then put them back in their carrier with the big clinky metal door, take them to another part of the clinic with new people and new smells and new sounds, and then attempt to do something like that. Doing these little procedures in the room, first of all, same with anything else fear-free, it can actually save you a lot of time in the long run, but you're really addressing, what the cat would prefer in that time, and I'm pretty sure most cats would not prefer to be, again, having to go through that carrier experience and going somewhere unfamiliar. Being prepared in your consult rooms for that. So in all our consult rooms, we're ready to do bloods at any point. We have all the little blood bottles, and we are ready to do that there, and that is always the preference. You will have sometimes some clients who don't want to be present, and that's absolutely fine. And in that case, I would ask the owners to please go sit in the waiting room rather than move the cat away from where the owners are. I think it's just kind of the next level, and I think that 10 years ago, I never saw vets and nurses attempting to do this in a room. Never, ever, because there's a bit of a fear as a vet or a nurse that things will go wrong or the cat won't react well, and that's going to look bad and things are going to get stressful, and that causes a lot of anxiety with the veterinary team. And I get that, and that takes a while to get over. But I think a huge part is setting the expectations ahead of time. So speaking to the owner, like, we like to do this here. We'd like to try that with you, comforting them, with you talking to them, with you feeding them treats. Some cats won't allow it. Maybe your cat will require a pre-visit medication and we'll try it later, or maybe they will require sedation. But setting those expectations keeps you feeling a little bit more safe then too. You haven't, not said anything, and if things go wrong, that you feel bad about it. So actually that client communication, telling them what's going to happen and attempting it. And sometimes you just have to jump in and try it. And you'll find that that's really the only way to go. It's like, now, if I saw a patient cat or dog, but a cat being, taken away for their bloods, you get such a question mark over your head after. You're like, why is this happening? It's definitely not the norm anymore. And again, it saves you time. Better for cat, better for vet, better for owners.
Yeah, no, I agree. And we touched on this in last week's episode with Ilse as well, the whole kind of notion of, taking dogs out the back to do procedures. And I think one of the really big pieces is the anxiety that we actually potentially cause in the caregivers, because they're left wondering, well, where's my cat going? Where are they going to be? What does it look like there? What other people might be involved? They maybe haven't met those people. is my cat being taken away because it's going to be forcibly restrained, and the vet team doesn't want me to see that. So thinking about it myself as a pet owner, as well as being on the other side as a veterinarian, I would feel extremely anxious if my pet was taken away from me and I didn't really know what was going on. So I think that's another piece that factors into that, and giving the caregiver that choice. You're very welcome to go outside and wait, grab a coffee cup, grab some water, or you can stay here. And I think there's potentially a slight difference between dogs and cats. I think, for dogs, maybe the caregiver presence is a bigger comfort than to cats, although we know that cats, can get equally very, very bonded to their people. But yeah, just, giving that choice, I think, to everybody reduces anxiety. And I totally agree with you, having that really open communication beforehand to set those expectations and make sure that everyone knows what's happening. And that's also another kind of education opportunity for the client, to say, look, your cat's feeling really uncomfortable. As you can see, feeling really comfortable with having this blood draw. I think it'd be a great idea to kind of give them a little bit of chemical help to either relax them further or to sedate them. And you'll get a much easier buy-in, I think, from the clients if they can actually witness and see what's going on.
Yeah, absolutely. I think this is something too that is very much vet-led. So I think that, vets doing this and seeing the benefit of it is incredible. I think sometimes nurses want to try this, but they maybe can't say in the moment, hey, let's try this, because the vet is in charge of a consult. So if you are a nurse, it's really a great idea, like beforehand, maybe to mention it, or to set up in the room full of blood. So it's something I used to like to do, to set it up. So when it comes time for, we're going to take away blood, everything is here. And just to edge towards this happening. It's not something that will happen overnight, but to, do them when you can, or do them when you have a patient that you think will be a little bit more receptive. I think it's important to remember too that whole taking them in the back, that there's this old concept that, they do better without the owners. Cats and dogs, like they do much better. And that we have to remember, are they doing better, or are they shutting down a bit, or are they so scared that they're frozen in fear? I don't think it's necessarily better. And I think that we need to think of the long-term health of the animal, mental, emotional, as well as physical. It is not necessarily better, even if you're able to get it within a couple of minutes.
Absolutely. And again, we talked about this last week a little bit as well. Exactly that. Just because they're immobile and they're tolerating a procedure doesn't mean that they feel comfortable about it. And like you say, that shutting down and that freezing, we know that that's, a really valid stress response, fear response. And it's going to cause them to learn, that learning is going to happen, that conditioned emotional response, negative emotional response. So the next time they come to the veterinary clinic, they are going to have learned from that previous experience, and they're probably going to feel worse when they come back for the next visit. So it's all about, like you say, setting them up for success in the long term and making sure we've got a longevity plan in place for future vet visits, right into when they're senior cats and coming in for their senior health checks as well.
Yep, absolutely.
Alrighty, so that concludes our 5 top tips. I love all of them, and what I particularly love about them is how practical they are and how easily they can be implemented, and also how inexpensive they are. I think that's a massive factor, especially for any practice who's kind of maybe toying with the idea or wanting to have some more information, maybe try out some fear-free approaches. I think they're all really, really great ideas without having to kind of break the bank.
Yep.
Okay, so let's move over to what is the one thing that you couldn't live without. So as I mentioned in last week's podcast, this was actually a question that I've been asked a couple of times, like, what do you think is the one thing that makes the biggest difference? If you could change one thing in every practice around the world, what do you think that thing would be that would make the biggest difference quite easily to the most patients?
For me, it's very easy. It is species separation in all areas of the clinic. Cats and dogs should not be in the same places. There's a million reasons why, and it's something that, depending on the space of your clinic, you can manage it in different ways. There's some clinics that have cat hours, cat days where they separate it like that, but within the actual hospital, keeping cats and dogs hospitalized separately is super important. I cannot imagine being in a clinic that had cats and dogs hospitalized together, which I think most clinics in the world probably do have them together. Once you see how much more relaxed the patients are when they are not with the other species, you can't go back to seeing them together. I had much earlier in my career, and a good example of that, and that I had started in cat-only veterinary, and that's all I knew. And then when I went and locumed in another country, and cats and dogs were together, and I couldn't believe it. And there was a cat one day, and it was recovering from diaphragmatic hernia. And you can imagine how important it was to keep their stress as low as possible. And right below her was this great big German Shepherd who was very vocal and very active. And I was beside myself seeing that, because no matter what you do with your nursing care, no matter what you do from the medications that you're using, from what you are able to put into their kennel, you cannot take away the fact that they're in a small confined space with the dog. I think having separate areas in your hospital is the one thing that I could not live without. I think a lot of the other things you can make a plan, but that for me is my non-negotiable for vet clinics, is to keep cats and dogs separated.
Yeah, it's actually funny you say that, because I'm just thinking back to the earlier years of my career. I can very well remember a veterinary practice that I worked at that had dogs and cats, at the time a cockatoo and also a primate, a small monkey, all in the same hospital ward. I remember that clear as day. And I guess I wasn't as well versed as I am now in sort of the consideration of that. But thinking back on that, oh my God, like that would have been extremely stressful for, imagine the bird prey species, and then you have a primate, and then you have a dog and a cat who essentially are predators, and cats can also be, how confusing for everybody and how scary for everybody. And yeah, that's quite a challenge. And last year I was in a large veterinary practice in the US, and I remember seeing cats and dogs in the ICU ward together, and they're all critically ill patients. And I remember seeing a cat next to a seizuring dog, which, is stressful for anybody to witness, let alone the poor cat that was next to the dog that was seizuring. So yes, it does still happen. I agree with you. I think hopefully the education is getting more out there, but I think you're very right. That is definitely one thing that I think we all at German Veterinary Clinic would find very difficult to. Yeah, I think even if a dog attempts to go near our cat consult room, we get a bit of a heart attack.
Yeah, we chase them out. Yeah, it's. I use the word sacred, the cat consult room. Same goes for dogs. Those rooms are sacred to their species, and we do not mix them. They stay very much cat only and dog only. And I think we're very fortunate that we have this beautiful large villa that the clinic is in, and we have the luxury of space. But you can implement smaller things to help with that. If you can't have a separate room, then we have these great privacy screens that we're able to use. You can fold them up, take them somewhere else. So if you aren't able to separate them in rooms, then use visual blockers and create, room dividers yourself, just to keep them a little bit separate. Use music, use pheromones in their individual kennels that are species specific. Use all of these other little, fear-free touch points to help to separate them if it's physically impossible to completely do it.
Yeah. Absolutely. I think there's always something that can be done to move towards that, for sure. Mm-hmm. Right. I'm going to give you the one thing that I can't live without, and I'm pretty sure you probably already know what it is. The absolute biggest game changer for me in feline veterinary practice has been gabapentin. And that is the one thing that I could not live without. Certainly as a vet, as a veterinary behaviorist, soon to be a specialist, fingers crossed, gabapentin is just the one thing that I couldn't live without. It has really changed the way that we are able to practice with cats. It's given us a tool that enables cats to come into the veterinary clinic already in a far less stressed state. It makes that whole transport to the veterinary clinic potentially a lot easier and safer for the caregiver. It's extremely safe. The only kind of situations where you need to take care of cats that have renal challenges or that are that have renal disease. So in those cases, you need to use a lower dose, but you can still use gabapentin. But the degree of anxiolysis and how much calmer and more relaxed the cats are is just, absolutely mind-blowing to think that, I spent the first 15 years of my career not having gabapentin. And the great thing is we have a whole bunch of research. We've got some really nice papers. We actually have a paper that looks at gabapentin as specifically a pre-veterinary visit appointment medication. And we have other papers that show the use of gabapentin in cats in other scenarios, including sort of trap, neuter, release type scenarios. So it's well researched and it's well documented, and that there's great sort of there are safety studies out there as well. So it's a great medication to use, and I just don't think that you can do feline practice without gabapentin anymore, for sure.
Yeah, I agree. I don't know what we would do if there was no more gabapentin. I think that owners can see the difference right away, and it just becomes something that everybody needs for their trip to the vet. Even if your cat isn't very fearful or very anxious, that it's still going to make it a more pleasant experience for them. I wouldn't dream of bringing my cats to the clinic without gabapentin on board. There's just no way.
Same. So there are a couple of other alternatives to gabapentin, although I think in cats gabapentin probably is my favorite. Although having said that, there is pregabalin, which is in the same family as gabapentin, and there is actually a licensed product now that's come out in Europe, and I think it's just been licensed in the US, called Boncat, which is a pregabalin gel that with a very easy sort of applicator, where you give a very small volume of gel into the cat's mouth before a veterinary visit. And because it's licensed, obviously, if your country does have that, then that's probably the thing you should use first. Works very, very similarly to gabapentin. And we have a couple of other pre-visit pharmaceutical options, but none of them are quite as, safe. They come with perhaps more side effects, such as the benzodiazepines. But yeah, there are options out there, but I think gabapentin and pregabalin would be my first choice always.
I'd say as well, it's not even just for pre-visit, but that is so handy in the hospital. We have patients here for a long time, and when we know that they're going to have a catheter change or blood taken, if it's medically suitable for them, we will schedule their gabapentin and then schedule the actual procedure that needs to happen 2 hours later. So within the hospital, it is very, very valuable as well, as long as you are able to stagger what you're doing and make it work like that. It is so worth including gabapentin as part of your inpatient treatment regime too.
Yeah, and sometimes what we also do is if the patient comes in without gabapentin on board and we find that we're just not able to progress with our consultation, the cats are getting really stressed and worried, and they have a high level of FAS, we'll then, if it's convenient, keep the cat in the hospital, give them a gabapentin capsule there and then, wait for those 2 hours, then perform the procedure, and then they can go home a couple of hours later. So it's really such a versatile medication, and it doesn't have to be given by the caregiver at home. It can still be used in hospital if the cat arrives and we feel it's just too stressful for them to be treated without gabapentin. And another one of my top tips is if you do have a procedure that's, maybe a blood draw that requires taking more blood. So we have a lot of cats here that travel. Obviously, we're based here in the UAE, so we do a lot of pet relocation. And oftentimes, if we need to get rabies titer tests, we have to take a larger volume of blood. And sometimes, cats don't necessarily like that. So we'll often combine a gabapentin, and then 20 minutes before the scheduled procedure, we'll give a butorphanol injection, and that's worked really well for us as well. And again, it's safe. You get the right level of sedation without it being the kind of sedation that you would maybe get with an alpha-2 agonist, where you're then sort of monitoring cardiovascular parameters. So that combination of gabapentin and butorphanol is really nice because they're still conscious, but they're sedate enough that the procedures are usually really easy to perform.
Yep.
All righty. So I think that brings us to the end of this podcast. I've absolutely loved talking about cats. I really hope that everybody listening has gotten something from this. I hope we've given you some tips that you can practically implement today or tomorrow in your practice if you would so like to do that. And yeah, please leave us a comment. Let us know if there's anything else that you'd like us to talk about. I'm pretty sure we'll maybe do a few more of these, maybe some of the things that are slightly more a long game in terms of implementing fear-free tools and practices. This was very much about quick wins and getting things done quickly. But thanks, Nora, for your insight as ever. It's been such a pleasure to chat.
Yeah, it's been awesome. Thank you.
And to everyone else, we will see you next week for episode 43. Bye for now.